The reason that we are talking about prioritization today and the reason it is such an important topic is you are guaranteed to see prioritization items on NCLEX. We all know by now that the NCLEX is a safety exam. So one of the best ways they can determine if you are a safe nurse is to assess your critical thinking. And one of the best ways to do that is through prioritization questions. Because prioritization questions typically don't just look at one client or one clinical condition. Instead, they are asking you to just look at the overall picture and progression that you expect for sometimes 4 clients. So they can be much more challenging than other items. But once again, hopefully today we make it a little bit more simpler. Also, I want you guys to know that prioritization questions are formatted many different ways. You may be asked to identify the highest priority or the most sick client, or you may even be asked to identify the least sick or the lowest priority client. So it's always very important to pay close attention to what that question is asking you. And also, I just want to remind you guys that priority setting is going to be a skill that you're going to use every day in practice. So it's important to continuously practice this skill and get better at prioritization because you're going to be using it every day. So before we jump into these practice questions, I want to briefly review a really good resource that we have here at bootcamp.com. It's our prioritization pyramid that we worked really hard on. And this pyramid is supposed to help you as you sit down to take these prioritization questions, navigate them using a very strategic approach to help guide you. So the way we use this pyramid is we start with step 1 on the left here, and we are going to eliminate any type of stable or chronic issues. So typically any client that is experiencing chronic ongoing issue or they are stable is not going to be our first priority. They're not going to have any type of life-threatening emergent issue that requires immediate care. So let me give you an example of those. A stable client is a client that perhaps has a sprained ankle and they have good pulses. There's nothing that would indicate that that client has any type of life-threatening risk or urgent need. Whereas a chronic issue might be a client with maybe advanced COPD and they have a pulse oximetry reading of, let's say, 93%. Would we expect a client with advanced COPD to have a pulse oximetry reading of 93%? Yes or no? I'm saying yes. Typically, these clients are going to have much lower pulse oximetry readings than a client without any type of respiratory illness. So this is a chronic issue that typically is not going to be too concerning. So once we're able to eliminate those stable and chronic issues over here on the left, we're going to move to step 2, which is our pyramid. And it's going to help us guide us to figure out what is truly the highest priority client or the most sick client. So starting at the bottom of our pyramid, we have airway and safety issues. So airway issues might be stridor. Maybe that client has inflammation of the airway, which we know is a huge concern. Or maybe they have a safety issue, maybe suicidal ideations with a plan. It's something that if we don't intervene right now, there is an immediate life-threatening risk to that client. So that's typically going to be our number 1 highest priority, followed by breathing, circulation, and disability. And disability is just a fancy way to say neurologic, so maybe stroke symptoms. And then our lowest priority issues are typically going to be up here at the green portion of our pyramid. That's going to be routine tasks or routine orders, expected findings, and psychosocial needs. An example of a psychosocial need is maybe our client is anxious or frustrated. And certainly we want to use therapeutic communication, address their needs, but it's typically not going to pose any type of life-threatening risk. So I know that was a lot. I just threw at you guys with that pyramid, but that's really laying the groundwork. And we're going to use this pyramid as we navigate these next couple of practice questions.